Hi, we're here again for another Periscope broadcast from Spectrum Health. Today we have John Humphrey. He's a urologist with Spectrum Health Medical Group, and we're going to talk about beards for the boys and men's health. And so thanks for being here.
Yeah, thank you very much for having me. I appreciate it.
We're going to jump right in. How's
Great.
that?
Sounds good.
So tell us about your area of expertise as it pertains to Spectrum Health.
Sure. Yeah, so I'm a urologist, as Mike said, and what I like to focus on is kidney stone disease, reconstructive urology, urethral stricture disease, as well as men's health, which encompasses a lot of men. So not only prostate enlargement, erectile dysfunction, but prostate cancer, testicular cancer, everything that goes into men's health.
Okay. How did you get interested in this particular area of medicine?
Well, it's funny because in medical school, you sort of go through all these different rotations, and one of my friends was a resident in training in urology and really wanted me to do it. So I did it early on in my rotations, and once I did urology, I didn't really like anything else, so made a decision for me. I think it came down to the personalities you work with, not only with your staff, but also with patients themselves. Men's health is an area where you may meet a patient for the first time in their 40s or 50s, and that relationship can last into their 70s, 80s. So it's really a relationship with the patient and the physician that can be lifelong.
Great. Okay. Is it a stereotype, or do men really not typically go to the doctor? Why do you think that is?
Well, it's certainly true, unfortunately. I think there's at least 25% reduction in men versus women that see their doctor annually. I think that part of it is if men feel good, they don't see a reason to go to the doctor, even though there can be warning signs there. They may brush things off as normal aging and think, well, I don't think that anybody can do anything for me for this, but oftentimes even simple symptoms that they may attribute to aging can be the first sign of something going wrong. So obviously this campaign and everything, we really want men to get to their primary care physicians to help them.
Yeah, you bring up an interesting point about seeing the doctor on a regular basis. I know in some other countries, I've read recently that they've kind of done away with the annual physical. What are your thoughts on, how regular should men be visiting their doctor?
Yeah, I mean, I don't think there's a cookie cutter answer for all men, and when you think about personalized medicine, you have to first create a plan with each patient from the beginning. So if somebody's doing great and everything's checking out, then of course you can extend that, but for other patients, annual might not be enough, and you have to check in sooner than that. One thing that we're looking into is possible better communication with physicians and their doctors without having to come to the office. So that might be a way to, extend the time when they have to actually come in, but still be helping them through their health problems.
Yeah. So so if I understand correctly, it sounds to me like it's creating the relationship with the patient, and then building a plan from there.
Right. And we can't do that unless they come in initially, but then it's something that you can work with the physician going forward.
Great. Yeah. Why do you think the numbers are so high when it comes to benign prostatic disease and lower urinary tract symptoms in men?
Yeah, so this is very common. Obviously, the statistics show that upwards of 90% of patients between the ages of 50 and 80 will have some form of prostate enlargement. Part of that is physiology. As men age, the normal hormones in the body can lead to growth of the prostate over time. Another reason in our society why this is a big deal is the baby boomer generation. They're between 50 and 70 right now, and so that's sort of the prime time for these things to be happening. And then finally, risk factors such as no exercise, weight gain, obesity also lead to these problems, which unfortunately is prevalent in our society as well. So.
Yeah, but it sounds like those types of things, there are things you can do about that.
Right. And again, this is why we need to get people to to come in and come up with a plan not only for treatment but also prevention of the disease coming and also progression of the disease.
Okay. So what can we expect to see from Spectrum Health in the future when it comes to men's health initiatives?
Well, I think that what we're focusing on now is that relationship with us and primary care. Obviously, primary care is the first step of getting patients into the door, but then also working with them to know when they need to see us. And that obviously doesn't mean that once they see us, they're not going to see their primary care, but it's a team sport, and so we all want to get on the same page and really create a men's health clinic feel where we're all working together for the patient's overall health.
Mm-hmm. Yeah, and so, and I know Spectrum has My Health,
Mm-hmm.
right? Do you use My Health to communicate with your patients?
We do, yes. It's a great tool that patients can go online and not only check their results, but also communicate maybe how they're doing after a certain treatment, or how a dose of a medication may be working for them, and that interplay can be very helpful and useful for patients.
Yeah. How do you like that form of communication? I mean, do you find that as really beneficial and useful, or?
I do for certain aspects. Obviously, for certain conversations, you want to be in person to have that human element. But I think it can be very convenient and fast, and a nice way for patients to connect.
Stay in touch.
Mm-hmm.
Yeah. Any other words of wisdom or things that you would recommend that men are on the lookout for? Or
yeah, the initial signs of prostate enlargement, BPH, lower urinary tract symptoms, can be as simple as getting up more frequently at night, having to go to the bathroom all throughout the day, and even potentially leaking urine, things like that. So if those things are popping up, certainly they need to speak up. Obviously, it's not something people like to talk about, but it can be important as a sign of something lingering that could become a bigger issue.
Okay. Well, thanks for taking a few minutes out of your day to talk with us. We have Beards for the Boys, #BFTB. If you would like more information on how you can get involved, just go to beardsfortheboys.org. We've got all kinds of great information there. And you can see that John's got his beard head hat on.
Mm-hmm.
They've partnered with us. They're donating part of their proceeds this month. So if you go to Beard Heads, you can buy your own hat, and part of the proceeds will go to Spectrum. But we have a great event called the Beard Off coming up on December 1st. Again, that information and registration is on the website, beardsfortheboys.org. Thanks, and we hope to see you soon.